Your partner is so the question is, what should you do first?
Okay, one step or two step?
It's going to be a two-step.
All right, this is a two-step question. Let's go.
You arrive for a 58-year-old male found unresponsive on the bathroom
All
floor.
right, stop right there. Anytime I have a
Mhm.
patient who's unresponsive, what's the first thing I do next?
Check a pulse.
We're going to check a pulse because we got to figure out right away, is this patient in cardiac arrest or not? Okay. If they're in cardiac arrest, then we're going to start CPR. If they're not in cardiac arrest, meaning they do have a pulse, then we're going to start rescue breathing if they're not breathing.
Mhm.
So the first thing is check for a pulse. If unresponsive, remember the order changes from ABC to CAB. Okay. Now, so this patient is unresponsive. So immediately I'm looking for check for a pulse.
Mhm.
Keep reading. He is
Uh, he is on the bathroom floor. He is not breathing normal and
not
has
breathing
no pulse.
normally. Okay. So we're going to say that's like agonal breathing or
Agonal breathing.
gasping kind of breathing. Okay. And
And he has no pulse.
all right, stop right there. What do I know about this patient? Because I was looking for pulse. They gave me the information. He has no pulse. That puts him in what?
Cardiac
All
arrest.
right, cardiac arrest. Is that an oxygenation, ventilation, or a perfusion problem?
Perfusion
It's
problem.
primarily a perfusion problem. What are the top 3 priorities in cardiac arrest? Number 1, it's going to be high quality CPR, high quality
Mhm.
CPR, not rinky dink CPR, high quality. The next is going to be early defibrillation. So we got to put the pads on. Well, first we got to turn on the AED or the monitor, put the pads on, allow it to analyze, and then shock when it tells us to, or when we interpret that we need to. So priority number 1 is early CPR, priority or high quality CPR. Priority number 2 is early defibrillation. Priority number 3 is IVIO access for epi. Okay. Now,
Mhm.
what we got to know here is CPR, though, consists of 2 things. CPR is chest compressions. It's also ventilation. So sometimes they'll break these up as like, if you had to pick 3 of what 3 things are you going to do? If they
Mhm.
give you compressions and ventilations, well, that counts as 2 things. If they don't break it up like that, then we'd go CPR, then defibrillation, then epi. Remember, if they break these up, this is 1, this is 2, this is 3. If they don't break it up, this is 1, this is 2, this is 3. Okay? But just know these are the top 3 priorities in cardiac arrest. So based on that, find me an answer. What should I
B.
do first? Find me an answer.
Begin high quality chest compressions.
Right, because that's kind of the starting point for cardiac arrest. It's immediate high quality CPR. Okay. Now, what about when the AED comes? When should you use the AED?
After the first 2 minutes of
Okay,
CPR,
and we
or as soon
ideally
as
we
you
want
get
to
it.
use it as quickly as possible. I mean, if we can go ahead and get it deployed even faster, then we will do that because the patient's chance of survival goes down about 10% per minute. Okay, now we're gonna do. Good job, Teresa. How did you feel about that?
Yeah, it's
Good. Okay, Jalen,
different.
you ready?
Yeah.
All right, Jalen, you're up, man. Let's go.